Thank you, Ty. Having a baby can be stressful. 1 in 7 women suffer from postpartum depression, now called perinatal depression. Dr. Rachel Glick is a counselor for soul searchers and is with us this morning to talk about the mental health impact of a new baby for both partners. Yeah, good morning to you.
Good morning.
Yeah, we've heard about the mom struggling with this, but now there's new research showing that really both struggle.
Yeah, they're actually almost equally at risk for depression and anxiety.
What does that mean, and why is that?
Well, some of the factors that trigger depression for new moms overlap with some of the same factors that actually the partner, which is a non-gestational parent, that could be the dad, it could be a partner of any kind. Yeah. So even hormones are affected by both. So the kind of onslaught of the marathon of new motherhood or new parenthood hits both parents, and sometimes the partner, the supporting partner as it's called, is also dealing with feeling a little left out. They're not part of the
bonding,
exactly as much. So, and if the mom is depressed, it affects them too.
Yeah.
And so they both really need to be really focused on taking care of their own mental health.
Well, what's the difference? A lot of people say, oh, you just have the baby blues. But depression is different from that, right?
Yes, baby blues is a shorter term sort of difficulty regulating emotions for moms. It usually lasts a couple of weeks. But depression is a whole different thing. It becomes more serious with a lot more lowness and anxiety and wanting to cry and not even being able to bond with the baby sometimes.
What are some of the steps that new parents can take to help them feel better?
Yes, well, the first thing is to accept themselves. It's very common, and not resist the experience they're going through. When we accept something, paradoxically, we're actually better able to draw strengths from it and do better in that scenario. And secondly is to really prioritize your health. It is not selfish. The expectation is that you're supposed to push through, and you really need social support. Really need kind of like your whatever tools you use when something in your life isn't right, unless you blank, whatever that is for you, make sure that you are working on taking care of yourself.
You say to identify your triggers. That's important, as well as prioritizing your health, right?
Yes.
Those things, yeah.
So identifying what it is that's causing the depression it helps us to feel more in control, just to know. And then from there, you'll be able to know which tool you need. Maybe likely everyone needs more social support at this time. And also to do things to really take good care of your body and also your spirituality. We tend to, whatever inspires us usually goes out the window when we're under so much stress, really.
Yeah, absolutely. And the final thing is stay a couple.
Yes.
Bounce off each other.
Yes, because that's one of the things that makes you're missing that connection. And it's hard to do. It's very understandable to prioritize the relationship, but make sure you are trying to have fun and remember that the two of you came first.
Yeah, absolutely love that. Dr. Rachel Glick,
Yes,
thank you so much.
My pleasure.
Some great advice for us this morning.
My pleasure.